maybe you've been on a plane before and you hear the call come over the intercom. Is there a doctor on the plane? And if you aren't a physician, maybe you say, oh, there must be something interesting here that's going on. If you are in medicine, you're probably saying, oh shoot, someone's gonna need me. I don't know them. I don't have any of my usual tools. How am I gonna handle this situation?
So yours truly got to experience that a few weeks ago on a flight home, and we are going to talk all about that today.
Yep. Just in case this is your first time meeting us, I'm Kurt. I'm a board-certified pediatrician.
I'm Sarah. I'm a board-certified OBGYN, and we are the Doctors Bjorkman. So I was recently traveling home from a conference. And I thought, okay, hey, this is great. You know, I'm going to take this red eye home so I can be home the next, I'll get some sleep, be home the next day, be able to hang out with Cease and Kurt and whatever. So get on the plane at midnight, buy myself a little neck pillow because I didn't have one, and get my window seat, get all snuggled up, ready to go. Kurt was at home being the primary parent, and I put my headphones in, I put in Taylor Swift's new album, and I'm ready to just have a lovely little flight. So about 20 minutes in, I hear a bit of a commotion, and over the intercom, is there a doctor on the plane? Please hit your light or whatever. And I am an OBGYN. So if there's somebody's having a baby on the plane,
this is your gal.
I'm
awesome.
your gal. Otherwise, I maybe am not the best physician to respond. I think family doc, emergency medicine, probably if there's some emergency on the plane, you go first. So I kind of take a headphone out and am kind of looking, and unfortunately this is happening in the row in front of me.
Or fortunately, they
Right.
happen to be right close
Right
to a
there.
very brilliant doctor.
Right. So
Yeah.
I am kind of assessing the situation. They call again, is there a doctor on the plane? And I am continuing to assess the situation, and no one is coming. And they ask again, and a guy comes from the front of the plane. He says, hey, I'm a first responder, been a first responder for 20 years. How can I help? And at this point I said, okay, well, guess I gotta get up. And so I kind of jumped out of the aisle and said, hey, I'm an MD, how can we help? And so in front of us was a middle-aged person who was kind of slumped over, not really responsive. The first responder had been trying to get some information from them, get them to respond, and wasn't getting much. The first responder had wanted to open the med kit, and the flight attendant was like, oh, we can't open the med kit unless it's an MD. And so I was like, well, I'm here, show me what we got.
But it sounds like you've done the right things, like when you're responding to an incident, you're checking airway was fine, he's breathing, and then you get to the heart stuff. Is their heart okay?
So open the bag, and in this bag there is the world's crappiest stethoscope, a bunch of, different meds, there's a list of where the meds are, one IV bag, 8 miles of tubing for said IV bag, and a blood pressure cuff. So I'm trying to talk to this person, trying to figure out some history, in their 60s, maybe doesn't have any, what the first responder told me is, oh, they have bigeminy.
Some irregular heart rhythm.
Right. So I'm like, oh, this is a heart rhythm, maybe heart block. This is not awesome. This is, I'm like, where's my cardiologist husband when I need him? So again,
home in bed sleeping.
Yes.
That's
so
great.
the only real history we can get is no medical history other than this heart rhythm problem. Maybe took an extra dose of Sotalol before getting on the plane. Can't remember, doesn't have a pill box, isn't sure. At this point, the kind of lays down on the seat and is not really responding. Find the pill pack in his pocket, and in fact, it is Sotalol. So I'm like, this is a beta blocker. Is this heart block? What's going on? And I'm trying to, meanwhile, all while this is happening, we're trying to get some vitals. And from what I can tell, there is a very, very weak pulse. The heart rate's like 30 to 40 per minute, which
normal being 60 to 100.
Right. So this is very low.
Half of the low end of normal.
Blood pressure, I've got the stethoscope in my ears, can't hear a heartbeat. It's just like whoosh on the plane. And so now I'm trying to get a blood pressure, which I also cannot hear with the stethoscope. I'm watching the cuff and I can see, I'm kind of watching to see it. If you've taken a blood pressure, you know what I'm talking about. So I'm seeing it and we're like 70 over 40.
Also very low.
And I'm just like, what am I doing? But again, we're all ACLS trained. It is a requirement, that you keep up with advanced cardiac life support. So I said, what am I going to do for this guy? Worst case scenario. And I'm running through this ACLS algorithm in my head. Meanwhile, they've put on me the headphones with a microphone and they're trying to connect me to some MD on the ground to give me advice, who suggested I have him sit up, drink some water to try to hydrate, and call him back in 15 minutes.
Yeah, which honestly is not often is fine advice if your vitals are normal. Like the issue that happens, especially with these red eye flights, is that you've got someone that maybe haven't been that well hydrated during the day. They've been in the airport. Maybe they had a couple of cocktails that causes their vessels to dilate. That might cause their blood pressure to get a little bit lower. And then they take a sleeping medication, or they take their nighttime medications. Maybe they took an extra nighttime medication. And so it's this classic setup to have someone who is low blood pressure during the night and has these symptoms of dizziness. And so kind of the first step, you're like, let's hydrate them, let's let time pass. And what could have been normal, but also it's like you were getting a very different perspective there in real life.
I was just like,
this person
pulse is really low, blood pressure is really low. The passenger is like laying down, really cold, not wanting to, have a conversation. Just not a perking up.
Not reassuring.
Not reassuring.
Okay.
And so I said, hey, I want you to get the AED open in case we have to shock or do CPR or different things like that. Have that available. Let me see what meds we have in here. Because for bradycardia, you treat that with a certain medication. Mm-hmm. And so I wanted all of that available. Meanwhile, the passenger could not sit up to drink, was too dizzy, kept feeling lightheaded and very dizzy. And so laid back down and said, we need to get that IV in. Yeah. And it's at this point that the person who'd been sitting next to me, who likewise had in fact brought a whole pillow and was like asleep, jumps up and says, hey, I'm an RN.
Thank you for nurses.
Right.
Yes.
Amen. Thank you, nurses. They were like, I took an Ambien, so didn't want to participate, but I'm here if you need me. So it's me, a nurse who's taken some Ambien, and a first responder taking care of a not pregnant, middle-aged passenger, which I felt was comical. But we were just doing our best to keep this person safe. So at that point, the first responder said to me oh, do you want to do the IV? I don't, and I said,
Where did you text me?
It was it was before all of this. At this point, I talked to the MD on the ground. That was not incredibly helpful. I really wanted to know, if this gets worse, next steps.
What do we do?
What is the best plan? And so, you know how you can get free messaging on the plane? You can iMessage or WhatsApp or whatever, as long as it's just messaging. I was like, please let me get this to work. Please let Kurt be awake right now. I know it's 4 a.m. there, but maybe he's awake. So I'm one-handed texting. Please be awake. Please hear this text. Please answer your phone.
And maybe it's just because I was solo parenting and I was maybe a little bit more vigilant to sounds in the house. Felt my phone that happened to be on vibrate go off, and it was actually kind of funny in the sense that I was studying for my pediatric cardiology boards, and you get these questions about toxicology and overdoses, and I caught this and I could see Kurt, someone took too much Sodalol. What do I do? Like, kind of like what is that? Which like instantly, like, oh, overdose. You need to do insulin and glucose and treat the low heart rate with like. I'm like have these things come through my mind, and then I like realized like, oh, this isn't a dream. Like I'm not having a nightmare about my test coming up.
This is where I was, and he's like, so just warning you. Sodalol has a really long half-life. It lasts a really long time, and
So it can prolong some of the rhythms that like
Are
gives
bad.
a setup for like some bad rhythms, depending if they took too much.
He's like, it's a setup for torsades, which is just like a notoriously bad heart rhythm that can put you into needing to be shocked.
That
anyway.
is, yes.
So I was like, oh, awesome. This is great. This is just great. So with that, Kurt was like, next steps, which is also in the ACLS algorithm, which I had in my mind was, the atropine is the next drug. You give this twice. And so we had a backup plan. Meanwhile, we're trying to get an IV in.
Because you've got this person who like has low blood pressure, and like if there's things you can do that are like before like getting to medications are great to do. I think at that time maybe the heart rate had started to come up a little bit.
At this point, a little more responsive, heart rate's coming up, blood pressure's a little bit better, so I'm feeling more comfortable. I was like, they said, do we need to emergency land? We can be on the ground in 18 minutes. And I said, I think we're okay right now.
Heart rate had come up, blood pressure had come up.
Yep.
And like had a plan to try to like get some fluids in this person who like wasn't
had
able to
the
drink.
IV tubing all set up. The first responder was just an amazing human, like had everything ready to go. But he goes, do you want to do the IV? And I said, no. The last time I did an IV was 10 years ago in medical school. Haven't done one since. I'm not your gal.
Yeah.
So it's you or my buddy, the RN here, who wants to try. So first responder, nailed it, got that IV. We hung the IV fluids, got a bag in. There was 1 second bag to give him a second 500 cc bolus. Most importantly, we wanted to keep the IV flowing in case we needed to administer any of those medications.
Yep.
And so after that first bag, we said, okay, let's just run this in really slow so we can give that medication. After that first bag, the passenger was really perking up, was having a conversation with us. Heart rate was palpable at the wrist as opposed to the carotid where I had been getting it at the beginning. I could hear Korotkov sounds on the blood pressure. We were 110/60. The heart rate was 60. I was like, woo, look at us go. OBGYN saving the day. So anyway, that was a fun time.
Yeah. I think like in terms of like for anyone, if you are in medicine and you're in a situation, like it's always a challenge where you put in a spot to like use skills that maybe you don't use often, but like you have some basic knowledge and you like, or like especially the challenges, we get so used to having so much technology or all of our normal tools around to like, here you're on an airplane providing medicine in the narrow way between the seats.
I'm like the freaking pregnant ladies here sitting between the seats taking a blood pressure every 30 minutes and doing vitals for this 3-hour plane ride.
And so if you're in a medicine and you're called like to a plane, like these things unfortunately come up. Like there's this setup of dehydrated patients with maybe some alcohol, maybe some sleeping medications in a compressurized cockpit, and maybe they like took some extra medications. Something like remember your ABCs, make sure the patient's stable, try to hydrate them well if you can, and then of course like use the resources that you have, whether it's the doc on the headset or maybe you've got the text phone number of someone who
friendly cardiologist.
Back things up too.
So thankfully, everything went very smoothly. Definitely kind of really perked up. The paramedics met us when we landed. The passenger walked off the plane. And so all's well that ends well. We didn't have to reroute an emergency land.
Didn't need to give any emergency medications.
Didn't give medications.
Other than the IV fluids.
Yep. And this probably was the first time they've had an OBGYN in their life, but everyone was very, very thankful that they had someone who could help that person through, and it certainly was an experience. I said, I'm going to throw this neck pillow away because, here I get all comfy thinking I'm going to sleep, and that didn't turn out. In fact, I think the cloud was the first responder who said he'd done this multiple times, had coded people, had emergency landed. I said, I hope we're never on a flight together again.
What's the line from the new Taylor Swift song that you were probably listening to? Me, I'm the problem, it's me. Yeah.
It wasn't me, though.
So
That was an adventure. I was very thankful to have the cardiologist husband on text just to reassure me that I was doing the right things. It's amazing the knowledge we have, even when you don't use it every day. Was very thankful I was up to date with my ACLS. And anyway, thought y'all would love that story.
a little different than our usual topics. We're going to get back to more pregnancy, young child care, infertility topics in the upcoming Wednesdays. And then, of course, our sit-down Sunday Q&As. Please make sure you're subscribed to catch those. We love that you're able to join us for our content that we put out every week, or try to anyway.
See you next week.
Bye, guys. We're doctors.
But not your doctors.
Anything we've said in this video is for education or entertainment purposes only.
It is not medical advice.
Any specific medical questions you have should be directed to your provider.